the arteries of the thoracic and abdominal wall. We were spending a lot of time up here in the thorax. Now we're going to talk about venous drainage. Okay, so going back to the internal thoracic vein, and there's an internal thoracic artery. Keep in mind that these blood vessels are going to be found on the front part. It's going to be on either side of the sternum. So it's going to be more on the front anterior portion of your thorax here. Okay, so that means, since this is in the front, that the internal thoracic vein is going to receive its blood supply from the anterior intercostal veins, because you have anterior intercostal veins, posterior intercostal veins. Okay, so the interior thoracic vein is more towards the front, so it's going to receive its blood supply from the anterior. Also, okay, if you recall, on the internal thoracic artery, there was two named branches at the very end, the musculophrenic that goes down towards the diaphragm, and the superior epigastric, that heads down towards the superior portion of your abdominal wall. Okay, that was for the artery. Same thing here with the vein. We have the musculophrenic that's going to be returning from the diaphragm. Okay, and then the superior epigastric will also be returning from the superior portion of the abdominal wall there. But here's the thing. Okay, the internal thoracic vein drains into the brachiocephalic vein. The internal thoracic artery, branches off of the subclavian artery. Okay, so some people will get that confused. They'll think because the internal thoracic artery will come off the subclavian artery, then the internal thoracic vein will also come off of the subclavian vein. It does not. It drains into the brachiocephalic vein. All right. The inferior epigastric vein, though, does, similar to the inferior epigastric artery, it will, meet up with the external iliac. Okay, so the inferior epigastric artery, comes off of the external iliac artery. Well, the inferior epigastric vein is going to drain into the external iliac vein. Okay. And then both our first branches here for the posterior intercostal veins comes off of that supreme intercostal vein, which again, is going to drain into the brachiocephalic vein. I'll show you pictures of this. All right, real quick here, and then we'll talk about the zygous veins, because those are new. There's no zygous arteries or anything like that. All right, so here we can see, here's our brachiocephalic. This is the right brachiocephalic. Here's the left brachiocephalic. Here's the right brachiocephalic vein. All right. So you can't really see it here on the left side, but here you can see. Here's the internal thoracic vein. Okay. So it's right here on either side of the sternum here, right? And it's going to receive blood drainage from the anterior intercostal veins. And then we get down here to the bottom part, the last two branches here. Here's the musculophrenic vein. This is going to be right here by the diaphragm. And then our superior epigastric vein is going to head down towards like your belly button. And it's going to anastomose here with the inferior epigastric vein, which drains into the external iliac vein. Okay. So now we're going to talk about this stuff over here, the Zygos system here. All right. All right, so keep in mind the Zygos system is a system of veins. There's only three, three named veins, but it's going to receive blood from the lumbar portion, of the abdominal wall and the posterior intercostal veins. And we just talked about the anterior intercostal veins. Those are going to drain into the internal thoracic. Okay, so there's two. Well, excuse me, there's three. Two on one side, two on the left side, and then one on the right side. So the hemiazygous and the accessory zygous are going to drain the left side. And then your zygous vein is going to drain the right side, but it also will have the hemizygous vein is going to drain into it. And then all those veins are going to drain right into the superior vena cava. All right, I'll show you a picture. Pardon? Zygous, I know, it doesn't get a lot of play. So this is probably the first and maybe the last time you'll ever hear of it. All right, so here we can see, let me zoom in a little bit and show you what I'm talking about. All right, so here we have up here the accessory hemiazygous vein, and it's receiving the posterior intercostal veins are draining directly into it. All right, and then down here we have the hemiazygous vein, and it goes all the way down and it receives blood drainage from the lumbar veins down here. Okay, so both of these veins, the accessory hemiazygous and the hemiazygous vein, are going to drain into this guy right here. This is the azygous vein. And the azygous vein drains right here into the superior vena cava. Zoom out. So this little schematic here may be helpful, may confuse you more. I apologize if it does confuse you more. All right, but this is basically explaining to you, all right, here's your azygous vein on the right side, and it's going to receive the posterior intercostal veins, all right, and the lumbar veins are going to drain right into that. The azygous vein drains directly into the superior vena cava. Now, meanwhile, on the left side, you've got your accessory hemiazygous vein, right, and that is going to get posterior intercostal veins draining into it. It will drain into the azygous vein. And then down here, all right, we have the hemiazygous vein, again, gets some drainage from the posterior intercostal veins and the lumbar veins. But the point is, not the point, but an important fact to know is the accessory hemiazygous and the hemiazygous both drain into the azygous vein. And that's going to return its blood to the superior vena cava. All right. Let's talk about some of the organs. We're almost done with the thorax, and we'll move down to the abdominal area here. Okay? Lungs. All right? So for the arterial supply, we refer to them as the bronchial arteries, and they're going to supply, remember your primary, well, we didn't talk about it past primary. You have your trachea, divides into the left and right primary bronchi. Okay? That's what we're referring here. Bronchial arteries are going to supply your primary bronchi, your secondary bronchi, your tertiary bronchi, and then they keep branching until they get down to these tiny little guys called the bronchioles. Right? Where do these come from? All right, they come off of the descending thoracic aorta. And your models here, way back, I can't remember, somebody asked me, I don't think I have it here. Might have been my other section. They asked me. Yeah, they had all these little, they're asking me what these, I don't know if you can see that, these little cut arteries were, okay? Those cut arteries are the esophageal arteries, all right, and the bronchial arteries. You just can't tell because you can't tell where they're going to, okay? Because she was asking me, oh, well, where's that going to? Or what is that artery? And I'm like, I can't tell you unless I see it if it's going to a specific structure. Because there's tons of little branches that come off of the descending thoracic aorta there and the descending abdominal aorta. Oops. Where am I? I don't even know where I am. Am I in Barton? Okay, here we go. Okay. So we have a companion vessel, the bronchial veins. Except for the companion vessels, they do not drain into the superior vena cava. They're going to drain into our Zygos system, all right? So they're going to drain into the azygous veins and also the pulmonary veins, okay? The esophagus, again, same thing. Those little tiny branches that we saw coming off of the descending thoracic aorta, all right, there's tons of little ones. We'll also see, all right, some of these branches coming off of the left gastric artery. We'll see that in a second down in the abdominal region of the body. We'll talk about that in a second, all right? And then the venous return is going to, again, drain into the azygous vein, and in this case, we'll also have some branches that go into the left gastric vein. All right, as you can see here, tons of blood vessels supply the diaphragm, all right? Superior phrenic, inferior phrenic, all right? Superior is coming down, all All right, so you have your descending abdominal aorta, and you'll have the superior phrenic come down, so it's going to come off of the thoracic aorta above the diaphragm. Then you have the inferior phrenic arteries, which are going to come off of the descending abdominal aorta and move up towards the diaphragm. All right. Musculophrenic arteries, we saw those before. Pericardial phrenic arteries, again, more of these are going to be coming off of the internal thoracic arteries. And then we saw the superior phrenic and inferior phrenic last time. All right, let's get into the gastrointestinal. This is where we're going to really see some new stuff here and do some labeling. Okay. All right, the GI tract. This is when we start to pass through the diaphragm. We get into the descending abdominal aorta. The first branch that comes off is the celiac trunk. Okay, so it's like coming out straight forward. It's really small. Okay, maybe half a centimeter. Okay, in length, but it has 3 branches, and it's important that you know these 3 branches here. Okay, the first one is the left gastric artery. You're going to see that in the smaller or lesser curvature of the stomach. The other one is the splenic artery. That goes directly, that's an end artery that goes directly towards the spleen. And then the common hepatic artery, obviously hepatic, liver, it's going to head towards the liver, and it's going to divide into the hepatic artery proper, which is going to head right up towards the liver. And then it's going to give this descending branch that goes down, and that's called the gastroduodenal. All right? So I'll show you here on a picture here. All right, before I go to the labeling here, all right, the 3 arteries that we're going to talk about, mainly that come up, that are significant, that come off the descending abdominal aorta, are going to be the celiac trunk, superior mesenteric, all right, and then the inferior mesenteric. All right, so let's do a little bit of labeling here. And as you're labeling, I'll talk. It's cool. Yeah. Yeah, I loved it. That was my favorite subject when I was in med school, was gross anatomy. That and radiology. All right, so here's the diaphragm. We pierce through the diaphragm, okay? Immediately below that opening there. All right, that's remember the aortic hiatus, that opening in the diaphragm? All right, we have this celiac trunk. That little dot there is representing the celiac trunk. It just comes straight out, and it's maybe half a centimeter long. Then it branches into 3 branches here, okay? You've got the left gastric coming up here. That's going to head towards the stomach. Then you've got the splenic, which goes right out here towards the spleen, all right? And then you're going to have your common hepatic artery coming right here. All right. Then if we move just a little bit below the celiac trunk, then we're going to see the superior mesenteric artery right here, right above, all right, on our model here, this is the left renal vein, right above the left renal vein. And then you'll have this branch coming right off, and that's the inferior mesenteric. All right, descending abdominal aorta. Then you have 2 small branches that come off either side. All right, those are the gonadal arteries. Do not be confused, because we can't tell the gender of this model. All right, but if you're looking at certain literature, the gonadal artery can sometimes be referred to as the testicular artery, males, and the ovarian artery, females. Okay, just it'll be mentioned like that, so it's the same thing. Okay. Then you have these arteries coming off the side going to the kidneys. So that's an easy one. Those are going to be the renal arteries. Okay? And you got to be anatomically correct. So, all right, this is the right renal artery. This is the left renal artery on that side. And then, well, it's not on this model, so I won't show it to you. So it is on this model, but there's a better version of it. Okay. So it's really important. I'm going to show you another.
What about the gonadal?
Yeah, that's what I'm saying. Yeah, the gonadal, yeah. Right here and over here. Yeah, for our class, just refer to as the gonadal. But if you're reading something and they talk about the testicular or the ovarian.
You said it left
Oh yeah, you have to. Yeah, all of these you will have to. If it's a paired artery, you need to be able to, or vein, you need to be anatomically correct. Yep. All right, next slide. All right, now we're going to look at the veins. Okay. So here is the inferior vena cava. The inferior vena cava sits off to the right side. So pretty much where the descending abdominal aorta is, that's going to be dead in the middle. All right, it's going to be median. And then to its right is going to be the inferior vena cava. So if you see a vein going to the kidney, all right, if it's going over here to the right kidney, that's the right renal vein. If the left renal vein, check it out, it's longer because the actual inferior vena cava sits over to the right side. So the left renal vein is much longer than the right renal vein. Okay? Then you can see there's a vein coming from the spleen. That's the splenic vein. The splenic vein, all right, is going to be horizontal. This guy here is a vertical vein, all right, and that's going to be your inferior mesenteric vein. It's going to join up, dump into the splenic here. Then you got your superior mesenteric vein right here. Pardon? Venous vein, yeah, VV. And then right up here, okay, that's the portal vein. Starting to see some mixing of blood. And then what drains the liver are going to be your, well, it depends on which lobe that you're looking at, but you can't tell which lobe. So these are just the hepatic veins. And the hepatic veins will dump into the inferior vena cava. The venous system helps to drain, especially when we're dealing with the digestive system, right? As you're digesting food and stuff, it's going to flow into the venous system here, right? And it's going to head towards the liver. Because the liver, this is why I don't eat liver. Because the liver is like a filter. It removes harmful. Has anyone here ever had liver? Yeah. Have you, oh, so you had it? Yeah. I mean, I've heard some people, they say that it's good. I won't have it. It's just because it's a filter, you know. And I'm sure I've eaten some stuff that probably grosses people out too, but just liver, you don't agree. Okay. So this picture here, well, just to kind of give you a little bit of a different perspective here. Here, it's tough to see, but this is the celiac trunk. Here's the left, all right, that's the left gastric artery here. And see, here's the stomach. This is called the lesser curvature of the stomach, and then this is the greater curvature of the stomach. All right, but the left gastric artery sits here in the lesser curvature of the stomach. Then you got another artery coming out, that's the splenic artery going out here to the spleen. Right, and then we have our common hepatic artery coming here. And that's going to give a branch that goes down here. That's the gastroduodenal, because the duodenum, right here, here's the duodenum. Okay, so it's heading towards the stomach and towards the duodenum. All right, and then you'll have the common hepatic, which will divide off of here. So we go further down, all right, you'll have your superior mesenteric artery, and we can't see the inferior mesenteric artery on here. But the superior mesenteric artery has a couple branches on it, okay? And we'll look over these branches here in a moment, okay? So these small branches, and there's a whole bunch of them. So we just call them, we don't call it the first, second, and third. All right, we just call them intestinal arteries. And they're going to supply the 2/3 of your small intestine, the last two portions, the jejunum and the ileum, all right? Middle colic, all right, colic is colon. So that's going to go to the transverse colon. And I always remember that because the transverse colon was pretty much right in the middle of your body. Okay? The right colic artery is going to head off to the right. Well, that's where the ascending colon is. And then the ileocolic artery, you have a small valve, okay, that is found in between the ileum, the last part of your small intestine, and the actual cecum, which is the first part of your large intestine, this big sac-like structure, all right? So they call it the ileocolic valve, so that's how I remembered the ileocolic artery went towards the ileocolic valve there. All right, and then the other branch that we're going to talk about that comes off the descending abdominal aorta is the inferior mesenteric artery. Right? This is just before the descending abdominal aorta bifurcate, before it splits into the left and right common iliacs. So that we have 3 branches there. Left colic is going to go up. Here's your intestines. All right. So here's the splenic flexure. Okay. It's going to head up towards the splenic flexure and supply the distal portion of the transverse colon here. All right. And then the descending colon. Sigmoid arteries. Okay, it's a bunch of just smaller arteries that are going to go towards the sigmoid colon mainly, right, and the distal portion of the descending colon. And then I bet you can't guess where this artery goes to. Rectum? Damn near killed them. Bad joke. All right, here we go. No one ever laughs at that, but that's okay. It's a part of a joke, and I used to tell it, but most of the students didn't think it was funny, so I stopped telling it. All right. So just a quick look here at the superior and inferior mesenteric artery branches. All right. Okay. So here is our superior mesenteric artery. All right. So you can see as it's given, as we follow it down, you can see all these tiny little branches here. Those are the intestinal branches. All right, and all these go off towards the ileum and the jejunum there. All right, the first branch is the middle colic artery, and it goes up and it supplies the transverse colon here. All right, then we have this next branch. This is the right colic artery. It goes right to the ascending colon, and then down here we're heading towards this valve here. All right, that's the ileocolic valve. So the ileocolic artery, all right, is going to be heading down in that direction. That's how I remember it. All right, over here we have the inferior mesenteric artery and its branches. All right, so the left colic heads up here towards the splenic flexure. So it's going to supply the distal portion of the transverse colon and then the descending colon. All right, then we have our sigmoid arteries. Where are they? All right, here and here and here. So all these little branches are going to supply, all right, the sigmoid colon. All right, and then we have our last branch here that's going to head down towards the rectum, so that's the superior rectal artery. Pretty much the only branch that heads back that way. Okay, so let's label. There we go. All right, so now we're down into the pelvis. So here's our descending abdominal aorta. You've got your right and left gonadal arteries. Here's the inferior mesenteric artery. All right, then you have your common iliac arteries. Here's the left common iliac. Here's the right common iliac. Those divide, okay, into the right, internal iliac and the right external iliac. But you notice you have one artery. Those are paired arteries, okay? So you have left and right. This one right here, which is an unpaired artery, goes right in the middle, sits right on top of the sacrum. Right, that's called the median sacral artery right there. Okay, and if you're kind of wondering where you are in the skeleton, well, here's the femoral acetabular joint right here. Your hip, here, and here. Okay, so we're in the floor or close to the floor of the pelvis or the perineum. All right, questions so far? No, okay. I'm trying to remember because I've done lab in this course two times. This is my third time doing it, and I'm trying to remember because the first time I did it, I made the test and I put, I guess, questions on there that were a little bit difficult for the students, so I had to rethink things. So this one's a tough one though. I think the first test, though, the very first time I did lab, the first test, students did not do well on. So actually, they did better on this one. I think they just got better as we went through. Yeah. So for whatever reason, well, some people just didn't study the hormones enough. So if I labeled, the anterior pituitary or the posterior pituitary, I'd say name the two hormones that are secreted from this structure. And so they forgot, or they didn't study it. Huh? That's one of them. Does anyone remember the other one?
Canadian.
Oh yeah, I love it. You guys make me so happy. Make my heart flutter. All right.
About the anterior.
There's a whole list of them. There's a whole list. All right. So for the GI tract, okay, let's talk about this because the hepatic portal system is one of those blood flow systems that we talked about, in which you have an artery, a capillary bed, then a portal vessel, then another capillary bed, then a venous drainage system. So that's what we're going to see here, all right, when we're talking about the hepatic portal system. All right. So when you eat food and it gets digested from the GI tract, okay, this is the blood gets dumped into this system here, all right, and it gets sent to the liver, all right. So obviously, all right, we're going to send it to the liver to one, get rid of the harmful stuff, all right, but at the same time, we're going to also dump it into the blood so we can disperse the nutrients throughout the body, okay. And what's the liver do? It does so much. Gluconeogenesis, all right, glycogenesis, all right, it's going to do all of that, lipogenesis, all that stuff. We're going to start storing stuff. So why not send it there first, all right, or one of the early places for it to go, okay? All right, so there's 3 veins that are going to drain into our hepatic portal vein, all right? So we saw it earlier. We have the splenic vein. Here's our spleen. Here's the splenic vein coming along, okay, that's going horizontally. And then we have the inferior mesenteric vein that drains into that. And then we have the superior mesenteric vein that joins up with the splenic vein. And then from that point there, then we got our hepatic portal vein. Okay? And the hepatic portal vein goes into the liver, into what we call the liver sinusoids. That's when we get a mixing of blood. And we'll talk about that later on. Okay? But when the blood leaves the liver, it does so through the hepatic veins, right, which drain into the inferior vena cava. All right, so quick view here. Okay, so here's all our digestive organs: large intestine, small intestine. All right, and all that stuff gets digested out of there and goes into the blood system. All right, so we have our splenic vein here. All right, here's your inferior, all right, mesenteric vein coming up. Merges with the splenic vein. Here's the superior mesenteric vein. It comes up. When it meets up with the splenic vein here, then we're dealing with the hepatic portal vein. And that goes, up into the liver and into these structures here, all right? You have these kind of oblong-looking structures, and those are called sinusoids. All right, and this is where we get that mixing of blood between the hepatic artery, the hepatic portal vein. Things just get mixed up. The liver starts to filter things out, all right, and does what it needs to do, and then the blood, all right, will then drain into this structure here and out through the portal vein and out through the hepatic veins into the inferior vena cava. Holy moly, that was painful, and I'm sure it was painful to listen to. All right, so here you can see, here's our liver, all right? So really easy to remember. If it's blue, it's a vein. If it's red, it's an artery. If it's purple, it's a mixture, and the only time we see a mixture is in the hepatic portal vein, all right? So if you look here, all right, number 18, these are blue, or it looks like it's blue to me, all right? So that's going to be your hepatic veins because they're draining into this big fella here, which is the inferior vena cava. Then I see some red vessels here, all right? That's going to be the hepatic arteries. And then this guy here is purple. This is another purple one. Here's some more purple, all right? And that's going to be our hepatic portal veins, okay? All right. We're close. We're getting there. We're getting there. No, trust me. I know it's not easy, but at the same time,
On the heart, it was opposite. Like
it was enjoyable.
Red and blue.
Well, yeah, but remember, I mean, that has to do with, you know, the oxygenation levels.
I know, but that was like throwing me off.
Oh yeah, no. Or now we're back to normal
opposite,
stuff.
Opposite.
Yeah, we're back to the normal stuff. All right, so what's a posterior abdominal organ? All right, sometimes referred to as a retroperitoneal organ. If you remember the peritoneum, that was that serous membrane. And the kidneys are a posterior organ. What sits on top of the kidneys? Adrenal glands, right. So therefore, when we talk about the posterior abdominal organs, we're going to be talking about the kidneys, and we're going to be talking about the adrenal glands, okay? So when we're dealing with the arterial supply for this, the middle suprarenal artery, you can also refer to as the adrenal gland as the suprarenal gland, all right? So the middle suprarenal artery is going to come off of the abdominal aorta, all right, and it's going to supply the adrenal gland. Renal artery, you know what that's supplying. Gonadal artery, again, depending on the sex or the gender of our model, all right, it'll either go to the testicles or to the ovaries, okay? So all of these come off the descending aorta there. And the nice thing is when we're talking about venous drainage, it's all the same. Same name. Ooh, look at all these that you have to memorize. I'm just kidding. All right, I'm just kidding. All right, but quick, let me just run through it here and then we'll finish up. All right, the pelvis and the peritoneum, that's the floor to the pelvis. All right, so the descending abdominal aorta bifurcates and splits off into the right and left common iliacs. Okay, the common iliacs will then divide again or bifurcate into the external and the internal iliacs. The internal iliac goes into the pelvis. Okay, now again, I'm not going to go through all these, but if you glance at them, superior gluteal arteries, inferior gluteal artery, all right, that's going to go to the glutes, okay, the gluteal muscles. All right, superior vesical artery, all right, that's bladder. All right, but look, rectal, you know where that's going. The vaginal and uterine artery, if you look at the names, it's not too difficult to figure out where they're going. The obturator artery is going to have, if you remember on the pelvis here, all right, you have the obturator foramen. That's a blast from the past. Remember this hole here? That's at the pubic bone. All right, the obturator foramen is on the medial portion of your thigh. All right, it's closer to the medial portion of your thigh. All right, so this artery then is going to supply, all right, the medial portion of the inside of your thigh. What's there? The medial thigh muscles, your adductor muscles, all right, and some of like gracilis and some of your hip flexor muscles. All right, again, just glance over this. There's not going to be, I can't guarantee you, but I'm almost positive because I've looked at the test bank. You're not going to be asked about that, all right? But if asked, just take a guess just from the name of it, okay? All right, okay, I'm going to stop here today, but let me just show you some of these real quick. There's no more art. Oh, we've already seen this. Sorry, guys. Here. Okay, this is what I wanted to show you. All right, so you can see here with the common iliac artery, all right, as it bifurcates into the external iliac artery, into the internal iliac artery, all right, this is basically, all these arteries are going to supply all the organs in the pelvis and also in the floor of the pelvis, all right? And that's going to include the stuff on the back. So your glutes are back here, all right, your medial thigh muscles are down here, and then any of the organs, for ladies, it's the ovaries, the uterus, all right, vagina, all right, for men, well, the gonadal artery comes off of the abdominal aorta, but still, that should be, yep, all right, I'm going to stop there. Any questions? Not bad on time. I know, but again, I've got a whole nother. I got a whole nother lab class in which I can go over. The next lab class, we're going to finish this up, and I'll probably do a little bit of lecture in that lab class.
So we have class on Monday.
Oh yeah. Why? Is there?
President's Day.
Oh yeah. No, we still do. Yeah. Yeah. I was like, wait a minute.
I
What holiday?
couldn't remember if it was.
Yeah. No, we do.